West Nile virus spreads in Philadelphia. Essential Health 365 advice to protect yourself. Hey everyone, welcome back to the channel. It's great to see you here again. Today, I want to talk about something that's making headlines right now in Philadelphia, the West Nile virus. If you've been hearing about it recently, you're not alone. I'm here to break down the key things you need to know to protect yourself and your loved ones. On July 18, 2025, public health officials in Philadelphia confirmed the first case of mosquitoes infected with the West Nile virus this season. And while it might sound a bit alarming, let me assure you that there's a lot we can do to stay safe. But first, let's talk about what West Nile virus actually is and why it's been catching so much attention lately. So, West Nile virus is primarily spread by mosquitoes. Around 20% of people who are infected with the virus will experience symptoms, and while most of these symptoms are flu-like, things like fever, headaches, muscle aches, and fatigue, there's a darker side to it. In rare cases, the virus can lead to severe neurological conditions like encephalitis or meningitis, which is inflammation of the brain or the membranes around it. Now, here's where it gets a little scary. About 10% of those with these severe conditions can unfortunately die from the complications. And who's at a higher risk? The elderly and anyone with a weakened immune system. So, if you're in a higher risk group, or if you know someone who is, it's especially important to be vigilant. The Philadelphia Health Department is urging healthcare providers to be on the lookout for patients who might present with unexplained neurological symptoms, like encephalitis or meningitis. So if you or someone you know start showing signs of these symptoms, make sure to seek medical attention right away. The health department will continue testing mosquitoes for the virus until the first frost, which is usually around late October, so we still have some time before this season officially ends. But let's not wait until we're in crisis mode. There's plenty we can do right now to protect ourselves. The city is advising people to use insect repellent with DEET, picaridin, or even eucalyptus oil. Wearing long sleeves and pants, especially during dusk and dawn when mosquitoes are most active, can also help. And this is a big one. Mosquitoes breed in standing water, so make sure to empty out any containers around your house that might collect water. And, if you live in an area where mosquitoes are a concern, try using window screens or even mosquito nets to block them from coming in. These are simple yet effective steps that can really make a difference. Now, from a doctor's perspective, this isn't just about a flu or a mild inconvenience. It's about being proactive and aware. The reality is, as the weather gets warmer, mosquito activity increases. And with that, the risk of diseases like West Nile virus. It's something that can affect any of us, but with a little knowledge and a few precautions, we can drastically reduce the risk. Remember, it's about making small changes that protect your health 365 days a year, and that's what Health 365 is all about. You deserve to feel safe and secure every single day, no matter the season. Now, let's dive a little deeper into why it's so important to stay on top of things when it comes to West Nile virus. A lot of times we might think that diseases spread by mosquitoes are only a problem in far-off places or during the summer months, but the reality is, they're right here with us. And that's exactly why awareness is key. You know, as a doctor, I see it all the time. People often underestimate the dangers that mosquitoes pose. But let me tell you, West Nile virus is not something to take lightly. It may start with something as simple as a headache, muscle aches, or a slight fever. But in some cases, especially among older adults or those with compromised immune systems, it can progress quickly to more severe symptoms, including confusion, seizures, or even paralysis. That's why catching it early is so crucial. If you or a loved one starts experiencing those more severe symptoms, don't wait. Get medical attention right away. Let me share a quick story from my own experience. A few years ago, I treated a patient who had been bitten by mosquitoes during a camping trip in the late summer. At first, she just felt like she had the flu. Fever, body aches, maybe a little tired. But after a few days, she started feeling confused, and her family noticed that she was having trouble speaking clearly. By the time she came into the office, she had developed encephalitis, a serious condition caused by the West Nile virus. Thankfully, we caught it early enough for her to make a full recovery, but it was a reminder of just how quickly things can change. That's why I always tell my patients, don't ignore the early symptoms. If you feel unwell after being exposed to mosquitoes, especially if you're in an area where West Nile virus is common, get tested. The sooner you know what's going on, the better we can treat it. Now, I want to address something that's really important when it comes to health: prevention. With something like the West Nile virus, taking simple steps to avoid mosquito bites can save you a lot of trouble. It's not just about slapping on bug spray once in a while. It's about consistently using repellent when you're outside, especially during peak mosquito activity times, dawn and dusk. And here's a tip you might not have thought of. Mosquitoes love stagnant water. If you have things like flower pots, bird baths, or even clogged gutters where water can collect, make sure to drain them. It's a quick fix that can dramatically reduce the number of mosquitoes around your home. If you have a pool or pond, make sure to keep the water moving or add mosquito larvae-eating fish to help keep the population under control. Little changes like that can make a huge difference in reducing the risk of infection. Another important point to mention is that we're seeing more cases of West Nile virus each year. As the climate changes, we're experiencing warmer temperatures for longer periods, and that's just extending the mosquito season. These little creatures are more active than ever, so it's something we need to be aware of year-round, not just during the summer months. That's why I like to think about this as a 365-day health concern. Every day matters when it comes to your safety. So, while the news might seem a little alarming right now with these recent cases in Philadelphia, the key takeaway here is that we have the power to protect ourselves. With the right precautions, like using repellent, wearing protective clothing, and keeping our living areas free of standing water, we can dramatically reduce the risks of the West Nile virus. Before I sign off today, I want to remind you that your health is worth the effort. It's not about living in fear, but about being informed and proactive. And if you need any further information or just want to chat about staying safe, feel free to reach out to me in the comments. I love hearing from you, and I'm always here to help. So, that's it for today's video. Stay safe, stay protected, and remember, your health isn't just a priority during a crisis. It's a priority every single day. If you found this information helpful, make sure to give it a thumbs up, share it with friends, and don't forget to subscribe for more health tips on Health 365. Take care, and I'll see you in the next video.